So welcome to the volunteer gathering for 2022. It's been such a long time since we've all been together, and I'm really grateful for all of you who decided to come on out and brave the cold spring temperatures. Just to let you know, this is being professionally recorded. There are a lot of people who have joined our volunteer group here from across the state, and it's a bit of a drive to get into the Chicagoland area. And there are still people who, quite frankly, don't feel super comfortable about being, in a room with other people, not masked. We're just coming out of this pandemic. So just to let you know, you'll see a camera there. We are professionally recording this, and the link will be available probably within 1 to 2 weeks. We'll share that with all of you, and you can share widely. Please feel free. This is not, you don't have to register to see the recording. It's for everyone. So please share widely with your own volunteers in your own communities or people in your friend and family circle that might want to know more about AFSP. Okay, so this is AFSP 101. It's just kind of a brief overview, so you kind of get a background on who we are and what we're doing. We are engaged in the fight to stop suicide. So today's agenda for 101 is we're going to talk about AFSP, why we fight for the cause, how we fight for the cause, and then a little bit about what we do here locally. So this is our mission, to save lives and bring hope to those affected by suicide. Go ahead and memorize that. There will be a quiz. No, but this is our tagline. This is our mission. This is great when you're talking to the press. If you're just talking out at a tabling event, people say, tell me about AFSP. This is our mission statement. It's succinct. It really gets to the heart of it. Here's our position statement. We are the voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy to take action against this leading cause of death. So a bit longer, but again, a good thing to kind of be familiar with as you go out into your communities. So AFSP was founded in 1987, and it was founded primarily by just a group of researchers and families who had actually lost loved ones, and they thought, well, there's surely something we can do about this. And at the time, in 1987, people did not think that there was really any way that you could prevent suicide, scientifically, practically, they just didn't think it was possible. But these people thought otherwise. And so now we've got a movement of over 1 million people with chapters in all 50 states and Puerto Rico. So there have been some changes to this presentation, even since they updated it not that long ago. So Puerto Rico is our newest chapter, and we're very happy to welcome them. And of course, we have an advocacy office in Washington, D.C. These are our 5 core values here: passion, community, harmony, impact, well-being. And so, these are all the things that you take into your work: passion for the cause, building community, working in harmony with other partner organizations like NAMI. There are lots of organizations out there doing good mental health work. But this is not a competition. We want to save lives. So if you're part of a partner organization, that's that whole harmony piece. We want to be working with these organizations. We want to be giving them some of the materials that we have that they may not have. Impact. We definitely want to measure our impact in the community and be able to demonstrate that, particularly to people who open up their wallets and give money to us. What am I giving money for? How does this help the community? You can help in our impact tracking. Every time you do an event out there in the community, we have this AFSPIL reached tracker thing. I think you all have the link, but I'll always resend it if you send you out on an event. Be sure to track what you do, even if it's not something I sent you out on, even if it's something that you were able to do in your own community. And it's like, you know what? I want to make sure AFSP gets the credit for this. I was representing AFSP when I did this. Be sure to fill out that tracker. It really helps us. And then well-being, that's a key part of this as a volunteer. You need to walk the walk if you're going to talk the talk. Take care of yourselves. If you're feeling stressed and you can't take a volunteer opportunity, don't take it. If you need to take 6 months off and do some self-care, that's fine. Believe me, we don't kick you off the volunteer list, and there's no minimum requirement. I may check in with you if I haven't seen you in a couple of years, but don't think that you have to take every opportunity. And if you need to step away, that's absolutely fine. This is important work that we're doing. It's also a little bit heavy at times. So AFSP today. So today we're the leading national nonprofit organization dedicated to suicide prevention. We're evidence-informed and driven by science. You'll hear more about that. We engage those who are personally affected, mental health professionals, and community leaders. So that's not just suicide loss survivors. That's a very big umbrella. And we're very proud that we have invested over $30 million per year in research, education, advocacy, and support for those affected by suicide. Here in the Illinois chapter, we are very proud to be able to offer all of our resources and programming at absolutely no cost. So that's another thing that you can take into your communities, is that this costs them nothing to have us come talk or table or whatnot. Never a cost. What AFSP is not. Okay, we are not a crisis center. We don't run our own support groups, except that we do have some loss survivor groups that are run, but on a volunteer basis, and that's just considered peer counseling, not professional counseling. We are not support groups as a chapter, and we don't make grants to other organizations, basically. So we're kind of looking for people to make grants to us, right, to support our work, not the other way around. Wow, we have a lot of really high-level partnerships here. I won't go through all of these, but these have come to pass really pretty recently, but these are all like incredible partners that we're now working with to inform our work and to partner with to get our messages out. Some really important people on this slide. So we keep our administrative costs low and focus on impact. I'm just going to say for a minute here, you'll see that our program services 82.9% and our administrative costs 17.1%. That's a little bit closer to 20% after this last year, but here's how we do that. Volunteers, right? So there's 2 staff people here in the Illinois chapter, and you'll see us later in our pictures later in this presentation. We really rely on our volunteers to be kind of our boots on the ground, to do the grassroots work, to deliver the programs, and it's the way that we're able to keep these administrative costs low, right? We don't have a bunch of people out in the field that we're paying a salary to. So that, you guys are vital to this. Okay, so now why we fight for the cause? Well, the timing is perfect. Mental health at this point is much better understood, and it's definitely in the public eye and general lexicon after the pandemic. Boy, everybody started talking about mental health once everything started shutting down, and I always like to say that's kind of the silver lining. People went, oh, I know about mental health. That's what I have going on right now when I have no job to go to and I can't get out of my house and my kids are with me. So that really the timing is perfect. It's gaining strength. People are speaking out, particularly celebrities. There's a lot more collaboration, and there's a lot more changing attitudes. Now people do understand that everybody has mental health and suicide can be prevented. This is a slide that's already outdated. So suicide is still, unfortunately, one of the leading cause of deaths. It still ranks there at number 10. But now the latest data is just over 45,000. So there has been 2 years in a row now a decrease. That's great. We're trending in the right direction. And this is this is 2021 is the copyright on this slide. And look, that's already out of date. We're doing great work. We need to just keep doing it, right? It's the second leading cause of death for those between the ages of 10 through 34. That's sad. That's a high number. Yes, Mike. Okay, so Mike is saying that that's actually been updated and it's the third leading cause of death. So anyway, this is a key group here that we want to focus on, and I'm sure you've heard a lot of stories recently in the media about youth mental health. Youth mental health. The youth have suffered the most from the pandemic. This is a big key focus area on everybody's mind. So a good opportunity to deliver programs. We're getting a lot of requests for youth suicide prevention. And then just so that you know that there are roughly 25 attempts for each death by suicide, which adds up to more than 1 million suicide attempts per year. It's just important to note that that's just the level that people are struggling at, right? And although most people don't go on to die by suicide, that's still a lot of attempts. That's a lot of people that we need to help and catch before it gets to that point. And then this is just a quick map showing you the suicide rate by state here. We're actually sort of in the lower, we're doing pretty good here in Illinois. So suicide is a leading cause of death, and it's preventable. It can be preventable. We like to say that. We don't want anybody to feel like they should have done something, that there was something they could have done. In a good situation where there's lots of resources and you step in at the right time, where they get help at the right time, and yes, there are interventions that can save a life. We never want a survivor to feel like there was something that they should have or could have done. So just to know that as you're going into the communities. Here we go. Again, this is just talking about how the public opinion is definitely supporting us. Most Americans believe that mental health is equally as important as physical health. That's a paradigm shift that is pretty recent. Most Americans report that they would do something if someone close to them was thinking about suicide. And most Americans believe that suicide is preventable. And now how we're going to fight for this cause, now that we know why we fight for it. So these are some of the things we do. We host a research connection. We do a lot of prevention education. We have a loss and healing department. We do advocacy in DC and in our local governmental agencies as well. ISP is complicated. I'm not going to explain that to you now, but we can talk more later if you want. Out of the Darkness walks, many of you participate in those, and that's how you found us. We have great communications and marketing. We have nationwide campaigns now that are really getting our name and our message out there. We We have Project 2025, which you're also going to learn more about. We work through our chapters, and then we also reach people through Workplace. We now have a Workplace Talk Saves Lives, and that's been a very popular program as well. We do a lot of research. There's a brochure in your folders about more about research. I just highly recommend. I'm not going to go through this, but definitely take a look through it. We're still the leading private funder of research and suicide prevention in the world. And here we go. This is just some stats about that. That current total investment of 23.7. I think it's actually even higher than that. Anyway, research is definitely how it started, and it's still a top priority for the organization. And this research connection that we're going to do, we did one virtually, we did two virtually, unfortunately because of the pandemic, but we're going to do another one IRL coming up in June, and you'll get information about that. That's a leading AFSP researcher who will come and talk to you about their research, and they talk to you about it in a way that is not super sciencey, so it's actually really fun and interesting to go to. They design their talk so that really everyone can kind of understand what they're doing. So we'll invite you to that. Prevention education, these are the kind of the programs that you're out there promoting for us. There's a lot of them. We'll talk about them a little bit more, but here's just a sampling of them. Talk Saves Lives, It's Real, actually, It's Real Teens is definitely more popular these days, More Than Sad for parents and educators. And then we do have a menu that you can actually see if you go to the afsp.org website and just go to our programs. You can see a pretty comprehensive list of all of the programs that we offer. And here are some of our tabling things. You've probably seen lots of these, and they're all in your packets as well, too. So these are just things that we can provide for free at any event. And then if you also go to that afsp.org website, you're going to see Voices of Hope. It's really nice. They're just short videos about people who have from a lived experience perspective, and they're talking about their own journey. This can be really nice, too, if you're looking to share a video during a presentation, especially from a lived experience perspective, and it's just very inspirational. So if you have a chance, I highly recommend clicking on some of these videos to watch them. Okay, so loss and healing is a big part of what we do still, and we do have the great honor of having the chair of the National Loss and Healing Council on our Illinois, comes from our Illinois board, and she's in the room right now, and she's Erica Barber, if you just want to wave. So yeah, we're very proud of Erica, our chair. So we do a lot of things there. International Survivors of Suicide Loss Day might be another way that you found us. We have several ISOSL Day sites, ISOSL sites throughout the state, and we do a virtual one. We do have the Healing Conversations program, and we have a very robust program here in Illinois that I'm very proud of, and that's peer counseling. And so if someone were to have a loss and they just need to talk to somebody else who had a loss, this is just peer counseling. It's not professional support. They can get matched up with a loss survivor, and they do try to match them with someone who has had a similar type of loss. So if you lost a spouse, you'll be talking to someone who lost their spouse. If you lost a child, you'd be talking to someone who lost a child, because it's different, specific types of issues come up in those certain types of losses. So definitely that's available and free. Correct. And since you're not mic'd and we're recording, she's just saying for the audience at home, yes, it's not an ongoing series. It's a one-time conversation. But people who have gone through it find it very helpful. So it's a good thing to promote if you know somebody who is a recent loss survivor. And these are just some of the other things that we offer in our loss and healing department here, and a lot of those are in your packet too, and some of those are on the back table. So anything that's not in your packet is probably on the back table there, and you can go peruse that at your convenience. The children, teens, and suicide losses is really a nice one too. Those kind of have to be ordered one-off, but if you know somebody who would like one, we can make sure they get a couple of those. And then Erica actually has a really nice book that she has authored called Conversations of Courage, and that's also not available through our AFSP website, but you can see Erica if you'd like one. And it's a workbook for families who have children who have, lost someone to suicide, and it's intended to be done with a caregiver, and you go step by step by step, and it really helps the child process and just understand and get through the loss. It's very child friendly. It's a wonderful booklet, and if you'd like to buy one, we do have some today here for sale, so you can see Erica or myself or anyone, and we'll get one for you. They're $20. Okay, and now we're going to talk about advocacy. So I think we even have more than 33,000 advocates representing all 50 states and Puerto Rico and the District of Columbia. So this is really important work that we've done. Being able to get our policy priorities turned into actual laws and action. So these are two of our board members, Steve Moore and Dimple Patel, who's also in the room. And they're so attractive that they're actually on the AFSP material. So another win for Illinois. So we have a national advocacy forum that's coming up. It's virtual again this year, so everybody actually can tune into it. You'll get more information about how to do that. That's going to happen in June. And then here we have a state capitol day. That was virtual again this time. But again, we're coming out of that virtual. And on our state capitol day, it is in person. We're able to meet with our legislators and have a table in the Capitol and really get a lot of visibility. And then we just go to both of these events with the things that are important to AFSP, things that we really think should be policy priorities to advance our cause of mental health and suicide prevention. And that's another area where we can really work with those partner organizations. A lot of times NAMI will have similar things they're supporting. And so it's really good to kind of team up with them. And it's wow, I've already heard about this. You guys are really a united front here. I guess I need to support this bill or co-sign it or be a sponsor. It's a program that it's basically for workplace, colleges, bigger organizations. And it's a screening thing that people can sign up for, but it's a third party situation and they sort of have to pay for it separately. Yeah, so it's a anonymous screening tool that people can purchase, a business can purchase, and the Chicago police, I believe, actually have purchased this and are using this now in their force, which is great. It's a program that you would buy, or the place would buy, the organization would buy, and then it's a whole system where people can be anonymously screened, and if they do flag for showing high risk for suicidal ideation, then there's a follow-up process. But it can remain anonymous as long as the person wants it to, or for the entire time. So that's what's really nice about it and why it's good for college campuses, places where maybe people don't feel comfortable just kind of walking into a counseling center, for example, or even coming forward and talking about it, about their issues. So it is a third-party thing that they would purchase, but let me know if you're interested. For sure, we can hook you up with the right people that will talk to your people about that. And then, of course, we have all these walks, the community walks, the campus walks, and then the overnight walk is coming up, too. And you can, there is an Illinois team, but you can start your own team, and that's going to be in New York City, so in June 4th. And it's overnight. It is what it says, so just be prepared. You do walk all night. That's not just a euphemism. You walk all night. So our communications and marketing, so we have implemented organization-wide messaging and design guidelines to ensure the safety and consistency in how the brand is represented. So don't go creating your own materials. You don't have to. You can get ours for free. And if you have a specific thing that you need made in a certain size, great. I can work with you for a banner that you need. We've got a whole list of assets now that you can use for materials. Our communications department is great. They do these campaigns we're about to come out with some really cool stuff for May is Mental Health Awareness Month. I just saw a preview of it. Really cool stuff, all available to you. You can download the social graphics and share them. You can make flyers. You can take them out into your community. We have national campaigns such as Seize the Awkward and Real Convo. Those are that we've partnered with the JED Foundation and the Ad Council to do these, and they get a lot of play. They're really, really popular. They get a lot of hits. It's been a really good way to get our message and our brand out. If you would like to do a blog, for example, or tell your story, or just refine your story for when you're out in the community, we actually have a person at the national office. We have a department at the national office who will help you craft your story and get it really succinct, make sure it's using safe messaging, make sure it's got a powerful beginning, middle, and end. Really kind of craft. If you're not a professional writer, it can be hard to make your story of that really good story that might get in the Mighty or, might be picked up by your local paper. If you would like some help with your storytelling, again, we can help you with that. And that's a service that we're happy to provide to you because your story is so powerful and we want to help you get your story out. And here are our communications partners. As you can see, they've really kicked up in these last few years. Netflix now, when they're in the beginning process of creating scripts and whatnot, now they'll come and ask us to look at the scripts. Not everyone, but it's a partnership that we have developed, and some don't take advantage of it. But that really helps us to kind of control the messaging that's going out from all these big names here, right? So Seize the Awkward, we saw a little bit about that. That's a public service campaign that was, again, in partnership with the JED Foundation and the Ad Council. And it's really directed toward young adults, ages 16 to 14. It's just a series of short little vignettes about how you can start the conversation. It's so awkward to ask somebody if you're really concerned about them. It's a hard thing to start that conversation. It's really been very popular, and we typically will include it in a youth presentation, for example. Maybe we'll show a few videos. At the very least, we give the link so kids can go, and their caregivers can go look at those videos. And then Real Convo is kind of along those same lines. We have guides that are available to provide tips for engaging in honest conversations and, giving insight into what talking about mental health might actually look like through example dialogue. So this is how it might go if you're concerned about somebody. You might start the conversation by saying this. I mean, it sounds like, okay, maybe you don't need this step-by-step guide, but really you're nervous, you're worried about your friend. It really helps to kind of have a bit of a script to lean on or to practice with. So I highly recommend Real Convo too. And here are just some of our marketing materials. A lot of those are in your packet or on the back table. Now, one thing that you do have in your packet that's really, really important is this speaking out about suicide, and that's the do's and don'ts. There are certain ways that we want to talk about the topic to make sure that it's safe and it doesn't trigger somebody to have a certain type of feeling, that we're not perpetuating bad stigmas, things like that. I highly recommend that you familiarize yourself with that document before you go out to speak publicly or even just at a table for AFSP. Project 2025 you're going to hear more about, so this is just a single slide. It is the nationwide initiative to reduce the annual suicide rate 20% by 2025. That's a bold goal, and it's only 3 years away, but you're going to learn some exciting updates about that in our update section coming next. So now we're going to talk a little bit at the local level. That was kind of like a national picture. We are here in the Central Division. Not that really affects you that much, but these are the divisions for AFSP. We're in the Central Division, which is also the very best division. We have a board of directors. Our executive committee is featured there on your left. We have Kara Levinson, who is here today. She's our chair. We have Beth Morrison, who is not here today. She's based down in the Carbondale area, a bit of a drive. She's our president. We have Mike Bushman. He is here in the back. He's our treasurer. And then we have Meg Graff. She's also not able to make it today, and she is our secretary. And then also on our board of directors, we have Erica Barber. As I told you, she's chair of the National Loss and Healing Council as well. We have Phil Martinez, who is here in the room with us today. We have Ann King from the Kankakee area. So if you happen to be in that part of the state, she would be a really good local contact for you. We have Mike Duffy, who is also in the room, and he's in the back in a yellow sweater. We have Dimple Patel, who is in the back as well. Vicki Webster, who is not here today, she's actually she's sort of situated really right across the Indiana border. So if you're in that part of the area, good person to partner with there. Works in Chicago, downtown Chicago, so definitely available for those areas. And then Steve Moore, who also couldn't be here today, and he's a longtime board member, and he sits on our Public Policy Council at the national level. And then we have some staff support. Very little, though. That's why you're so important, right? It's that whole volunteer piece. So today, here with us, we have Diana Casares, and she is our chapter development director. But what you're really going to want to know is that she's organizing the Chicagoland Walk this year. So if you have sponsors or you have any questions about Chicago or you want to volunteer for the Chicagoland Walk, Diana is your person to see. And that's her contact information. Oh, and that's my thing. That's me. My face is really big. I'm sorry about that. I didn't really look that big when I made the slides, but okay. So that's our email. And always just remember that emails at AFSP are first initial, last name, afsp.org. So pretty easy. So now, how do you get involved? You walk in your community. You sign up to be a field advocate. If that's going to be another slide coming up, but if you haven't done that, boy, it is so easy to be an advocate. And Mike Duffy can talk a little bit more about how easy that is. You can give a gift. That would be lovely too. We have a couple ways to do that. There is now something that you can find on our chapter page called Circle of Hope. There was not a very easy way to donate directly just to the Illinois chapter, not related to like a walk. Now you can go to the Circle of Hope page and make a one-time or recurring donation just to Illinois. That's a really nice development that helps people that just say, hey, I'd like to give a little bit to AFSP Illinois. How do I do that? You can partner to bring prevention to schools. Schools are hot right now. They are looking for suicide prevention and mental health training. This is a great place where we can show up to our newest presentation. Great. You can sponsor an event, or if you work for a company, definitely get in touch with myself or Diana. We're always looking for sponsors, and we'll bring programming to them. This is a nice benefit for them too. They can educate their workforce, and they can sponsor us. So it's a good partnership to have. And you can get trained to teach programs. So if you like to stand up and talk to people and you're comfortable clicking through PowerPoint presentations, you can definitely be part of our education outreach committee, and we can get you trained to do presentations. Thank you for joining us in the fight to prevent suicide. Together, we will save lives. And then this is how you connect with us specifically. I think most of you already either follow us or have this email on this website already, in your short list here. But this is just, again, how you can follow us. We do post on social media, and you can always tag us if you post on social media. So we're always looking for people. If you're out at an event, take a picture, tag us so that everybody knows how busy we are. And then you can also follow AFSP National. They have a lot of really good content that they share too, so I highly recommend following them. And welcome to AFSP. And that's the last slide, I think, right? I believe. Yay, we did it, guys.